Swagatam. You are all welcome to Saspandan TCM Academy. आप सभी का सस्पंदन TCM एकेडमी में हार्दिक स्वागत है। आज हम बात कर रहे हैं wind stroke. Today we are going to discuss the wind stroke. Okay, so what is the wind stroke? What is the cause of wind stroke? And what are the manifestations of the wind stroke? Okay. So good morning all. This is very important topic. So today I am giving you introductory session, and its main course will be coming soon. I will announce on the group main course. So you will be expert to treating any neurological conditions, any paralysis, any coma, any unconsciousness. So this is the best gift to you. Okay, let us today discuss about the introductory session. So I am giving little introduction. Good morning, Monita ji. Yes, you have to come on deck and you have to tell your experience how we treat your mothers while paralysis happening. Okay, you stay with this session. Good morning all. Okay, so let's start our session. So in this session, now let's go to wind stroke. Let's go to the wind stroke. So how will define the wind stroke? Okay, wind stroke के बारे में हम कैसे चर्चा कर सकते हैं, हम कैसे उसको डिफाइन कर सकते हैं. Okay, so wind stroke from the TCM perspective, it's related to the spleen, it's related to the liver, and also it's related to the kidney. And wind stroke refer to pathogenic factors involve pain. So what is the pain? The pain, it's mean wind and apoplexy caused by internal wind. Okay, unconsciousness, apoplexy caused by internal wind. So this is a wind stroke. It is a cerebral vascular accident. Cerebral vascular accident. We are discussing the wind stroke. Okay, and by wind stroke, that is the internal wind. It is the flame, internal wind, and this is the unconsciousness happening in case of the patient. So what happened, what make it very concerning. So we talk about the pathology, but what exactly happened during an attack? जब कोई पर्सन को अटैक आता है, ये जो विंड स्ट्रोक आता है, एक्चुअली व्हाट इज एग्जैक्टली हैपन, क्या हो रहा है, पेशेंट को क्या होता है. So know this, it's a suddenly loss of consciousness. Suddenly loss of consciousness and sometimes having slurred speech, speech disorder, and sometimes coma, paralysis, like that too. So what are the cause of wind stroke? Wind stroke के कारण क्या है, उसके what are the reason, what are the cause of wind stroke? So there are causes of wind stroke. Its etiology factors. Number one. Number one is no adequate rest. हमेशा काम कर रहा है, हमेशा काम, पेशेंट हमेशा काम कर रहा है. No adequate rest, like the workaholic person, always working, no rest, always working. It is a no adequate rest plus इमोशनल स्ट्रेस. अगर रेस्ट नहीं ले रहा है और उसके साथ अगर इमोशनल स्ट्रेस ले रहा है, तो ये वी स्ट्रोक डेफिनेटली हैपनिंग. ओके. एंड also the excessive sex, those who male is engaged with the excessive sex, so it leads to किडनी इनडिफिशियंसी. अगर एक्सेसिव सेक्स होता है तो किडनी का जिंक कंज्यूम होता है ना एक्सेसिव सेक्स में. हाँ, तो इट्स लीड्स टू किडनी इनडिफिशियंसी एंड किडनी नॉट नरिश द लिवर. ओके. अगर किडनी इनडिफिशियंसी हो रहा है, व्हेन देयर इज द किडनी इनडिफिशियंसी, then kidney is the mother and liver is the son, water is the mother and wood is the son. When mother is deficient, so mother cannot nourish the son. So if kidney is deficient, so kidney not nourish the liver. So that in the liver will be liver yang rising. When liver indeficiency, if liver indeficiency is there, then if there is the indeficiency, then yang will be rise. This is the TCM rule. If indeficiency is there, if any indeficiency there is there no pulling factor there, then heat will be increased now, so that the liver will be liver yang rising to lead the liver wind. I would say liver in को जन्म देता है, liver wind, internal wind. And the manifestation of this is the apoplexy, unconsciousness, coma, mental cloudiness, mental cloudiness. Okay, so see, because of excess work, excess overwork, because of excess sex, and because of this is the its manifestation of the cloud, mental cloudness, and paralysis, apoplexy, coma, mental cloudness, and the paralysis. There's another one cause of the wind stroke is irregular diet. If there is a irregular diet, our diet should be proper. Okay, enough nutrition. If there is a malnutrition is there, and you are taking your lunch, taking your dinner, taking your breakfast, okay, it's against the nature law. You should follow the organ clock. You should follow the organ clock. You should take your breakfast between 7 a.m. to 9 a.m. Okay, 8 a.m. is the perfect time. 8 a.m. So that time, whatever you are eating, your stomach will be digested. Okay, and you have to take the diet as per proper nutrition. Okay. Okay, so there will be another cause of wind stroke is irregular diet plus physical work. So some people are working, overworking, physical overworking like this, physical overworking. So this kind of factor will lead to spleen deficiency. So this type of it's lead to spleen deficiency. So what is the spleen deficiency? Spleen tumors, okay, spleen abscess, spleen infection and obstruction of the spleen, okay, that this spleen patterns will become because of irregular diet and overwork, physical overwork like this. This is a physical overwork. If people are engaged with the physical overwork, they definitely that spleen will be depleted. Spleen will be get deficient. So the spleen yang and kidney yang is the same deficient. Spleen yang and kidney yang is the same deficient. So that will lead to flame fire. If kidney yang is deficient and spleen yang is deficient, so that will lead to flame fire. So the manifestation of this numbness of the limb, flame fire. This is the numbness of the limbs, numbness in the hands, numbness in the fingers, numbness in the foot, numbness in the toes. Okay, this is because that flame fire. Okay, because of spleen yang and spleen kidney yang deficiency. So that also mental cloudness. Mental cloudness and aphasia. Aphasia. So whatever mind that person cannot be speak. So because of language problem, that some disturbance happening in the brain. Okay, that is because that manifests the language problem. That is the aphasia. And entire tongue of this sticky yellow coating. Okay, sticky yellow coating and red body. Tongue is the red body and sticky yellow coating like this. If you see this type of tongue, so you should let patient aware about this. So it is a chance of a wind stroke. So now let's talk about the external wind invention. External wind invention stroke. So what are if external wind? अगर एक्सटर्नल बाहर के विंड ने अटैक किया, ओके, इन्वेंशन किया, इन्वेंशन हो गया, तो उसके जो मैनिफेस्टेशन क्या है, व्हाट आर द एक्सटर्नल एक्सटर्नल विंड, ओके, एक्सटर्नल विंड and invention stroke manifestation, the weakness and numbness of the extremities, that is the same. Facial paralysis, that facial paralysis, if invention, external wind invention happens and stroke come, it will be facial paralysis and speech disorder, dripping, dripping saliva, like this, dripping saliva. Oh, so this is not a patient, it is an example how a dripping saliva is happening, okay, because of external wind attack. Dripping saliva, and it's caused the hemiplegia. Okay, do you understood? Do you understood these patterns? Very good. Okay, what about the tongue and pulse picture of the external wind invention? If there is a external wind invention, how look like the tongue and pulse picture? Okay, the tongue of external wind invention is thin, like this. This is the thin white coating, and pulse is the floating and rapid. If external wind attack happening, so pulse will be floating and rapid. So now let us talk about the yang tension stroke. So there are the many stroke are there. So yang tension and in tension. So first we are discussing the yang tension. So what are the manifestation in the yang tension stroke? So yang tension stroke manifestation is suddenly loss of consciousness. Okay, patient will be faint out. So yang tension stroke manifestation is a suddenly loss of consciousness with the clenched jaw. If there is a clean jaw, like this, clean jaw, and suddenly loss of consciousness, so it is, you understand, that is the yang tension stroke. And tightly closed hand will be tightly, okay, like this. Okay, this is rigid hands. So fingers not getting straight. The flexibility of the hand is no there. Okay, tightly closed hands and urinary retention. Okay, so urine will be not pass away. And red face, like this, red face, and patient have the fever, patient को बुखार आता है. Now, let me like to describe the complexion of the patient. Okay, red face like this, and the jaw is locked jaw, like clenched teeth. And what about the hands? That fist clenched, fist clenched. Okay. Now let's discuss about the tongue and the pulse of somebody with the young tension stroke. Okay, so tongue will be, this is the tongue. Tongue is red body with the yellow grassy coating. Okay, red body. This is the red body and yellow grassy coating. While the pulse is wiry, slippery, and forceful. If you take the pulse, pulse will be wiry, like wire, and slippery. Sometimes that pulse will be slip from your fingers, and forceful. Now let's go to intention stroke. So intention stroke, what are its manifestation? Intention stroke. Okay. So intention stroke is that manifestation is the suddenly loss of consciousness with the locked jaw, clenched fist, rigid limb, fecal, fecal and urinary retention, both that stool and urination retention. So that is a constipation. Okay, 5 days or 1 week, patient not getting stool pass. Okay, but this time a full complexion is dark lips. Okay, full complexion is dark and lips also dark. See, like this, lips also dark lips, and complexion is the dark. Okay, complexion will be dark. आपने कभी क्लिंच फिस्ट देखा है किसी पेशेंट का, पैरालिसिस पेशेंट का? हाँ, डू यू हैव सीन द क्लिंच फिस्ट इन somebody with the intention? Intention में फिस्ट क्लिंच, ये क्लिंच रहता है, क्लिंच फिस्ट. ओके, तो what about the tongue and first picture of the intention stroke? Okay, tongue of the intention stroke is the pale body, white and grassy coating, and pulse is deep slippery. Now let's go to the flaccid syndrome. Flaccid means lunge punch, एकदम no strength in the extremities, no in hand, whatever paralysis happening in that side, no strength, lunge punch. Okay, now that is the flaccid syndrome stroke. So what are the manifestation? Flaccid syndrome stroke. So manifestation this time present with a sudden collapse and loss of consciousness. If you touch her limbs, limb will be cold. and breathing weak breathing and incontinence. Incontinence. What is incontinence? Incontinence of urine. So no control in the urination and no control in the stool, no control in the potty. That relative will be get trouble. That patient will be always getting stool, okay, watery stool, and always getting urination. Okay, it is the incontinence. Okay, let's discuss how an improper diet will contribute to वीन stroke. अगर माल न्यूट्रिशन, अगर डाइट में कम है, माल न्यूट्रिशन है, न्यूट्रिशन प्रॉपर नहीं है, no proper nutrition, so how that condition, malnutrition, contribute to wind stroke. So improper diet will cause wind stroke because, for the example, too much intake sugar, improper diet, too much intake sugar, cold and raw food can weaken the spleen. And because of spleen deficiency, which lead to accumulation of the dampness. Okay, if when spleen deficiency there, spleen deficiency is there, it's accumulation of the dampness, which can turn to phlegm. Then dampness can turn to phlegm, and phlegm is the pathogen, one of the pathogen of wind stroke. Phlegm, understand, phlegm is the one of the pathogen of the wind stroke. And does it stop there? Like from the phlegm, what happens next together with the liver fire? So flame turn into heat. Flame turn into heat, and one extract the channels, and flame extract the channels and will disturb the orifice in the body, to eye, nose, mouth, ear, okay, and anus and urethra. These are the orifice of the, and it's affect the orifice. So we were talking about the liver fire. Okay, can liver fire also lead to phlegm accumulation? Yes. So they attack the meridians and disrupt the clear orifice. Okay, so soon I am launching the full course of this wind stroke. So we can treat this wind stroke with the help of TCM. Okay, there are the very brilliant treatment. Brilliant treatment is there. We can easily treat the wind stroke. And I'm giving you some points. If patients available to you when wind stroke come, wind stroke, it is because of mostly internal wind. Internal wind. All single points are helping in these conditions. Single point, okay? The tip of the fingers, you you have to simply bleed. Take the needle, take the syringe needle, 24 number needle, or take the lancet. You need to prick the each and every fingers tips and each and every the toe tips, and take a 20 drop blood from each fingers and each toe, tip of the finger and tip of the toe. Okay, that V stroke will be get reversed. So last time for 6 months ago, one of my student, Monita Patel, come on deck. I am going to unmute you. Monita Patel.
Good morning, sir.
Good morning. Good morning. Now she is my student, Monita Patel. So she called me one day and she was telling her mother was getting paralysis attack. So immediately
Yes.
I advise her to prick the fingertips and prick the toe tips, and she done. And immediately paralysis or the reverse. There is no paralysis symptoms. Monita,
Yeah. Yes,
tell
sir.
your experience.
This is on the 31st of December afternoon. Maybe she had already this attack in the morning. Okay. So the people, can you hear me, sir? Or I lost you?
Yeah, I can hear you.
But
Stay at one place. Stay at one place. Don't move.
No, I'm just taking you to my mom. Yeah, one moment.
Yeah.
Yeah, she's sitting fit and fine. That's my mom. And that's her right hand. Little still finger is left and little slurry speech is left, but she's all right. So this is our hero because of the superhero who's teaching you over there, Dr. Vivek Rane. Okay. She got stroke on 31st of December, and my maid informed me कि मम्मी का मुंह टेढ़ा हो रहा है, ऐसे लग रहा है. So we didn't know all that. I called sir. The sir ने बोला symptoms तो stroke के है, brain stroke है, it is paralysis. And whatever is mentioning like sleep and then sweet. When you were right now mentioning all this, no sir, I related everything. This is my mom. स्वीट टूथ सुबह से लेकर रात तक, तो आपने जितना मेंशन किया वो सब मैच हो रहा है. एंड द वे यू हेल्प्ड मी दैट डे, आपने मुझे फोन पे छोड़ा नहीं. 45 minutes to 1 hour आई बिलीव यू वर टेलिंग मी डू दिस. सो इट ऑल बिकेम ऑल राइट. विदिन 5 minutes of pricking my mom is saying मेरा आवाज वापस आ गया, मेरा सरदर्द चला गया. एंड देन सर इज सेइंग कांग्रेचुलेशंस, द पैरालिसिस इज रिवर्स्ड. बस सर आपने नहीं छोड़ा और मुझे आप पे विश्वास था. थैंक यू सो मच. थैंक यू सो मच.
Thank you, Monita ji. Thank you. So, friends, I am launching this miracle course very soon in this week. So, if you want to learn this V stroke, about the V stroke, how to identify the V stroke, how to diagnose the V stroke, and how to reverse the V stroke when patient is coming in early stage to you, you will be give miracle result to patient. Okay. Also, the chronic patient you can do. Okay. This was about the V stroke. It is the introductory lecture. Okay. So I am on app also. My app name is Saspandan. Saspandan. You can find in the Play Store. You find in the Play Store and you can install the app. There are the many free courses are there in app, so you can enjoy the learning. If you want to learn proper acupuncture, basic to advanced, okay, follow me and become the acupuncture rock star. So this is my aim. To every my student should be acupuncture rock star. Okay, so thank you very much. Thank you for joining. And good day. Ending the session.